What are the tests for diabetes? In this video, I'm going to explain everything about that. Which tests are used to diagnose prediabetes, diabetes, or to confirm normal results? And which tests are used to monitor treatment? I'll also talk to you about a very common question here on the channel, which is about the finger stick test, also known as capillary blood glucose. That's the test you do with a glucometer right there at home. So with this test, is 140 a really good value or is it too high? I'm going to explain all of that, both for people with diabetes and for those without diabetes, because the answer is completely different and you'll understand why here. First, I'm going to start with how diabetes is diagnosed. We can diagnose diabetes using 4 different tests. I'll explain each one to you using a chart, each one of them. The first and most commonly used test for screening to find out if you have prediabetes or diabetes is the fasting blood glucose test. What is that? This test measures your blood sugar level after fasting for between 8 and 12 hours. That's really important, okay? Fasting for less than 8 hours can give a false result, and so can fasting for more than 12 hours. It's not recommended. What is the value for this test? For this test, a good value would be less than 99 milligrams per deciliter. A pre-diabetes value, many people say there's a myth going around online that pre-diabetes doesn't exist. Not only does it exist, but it's very well documented, okay? So what is pre-diabetes? It's that stage where a person already has a level of insulin resistance, but they haven't developed it yet. They don't meet the criteria for diabetes. We know that a blood sugar level of 110, for example, is already a dangerous level that increases your cardiovascular risk, your risk of having a heart attack or a stroke, for instance. It's worth mentioning that I'll always provide the values in milligrams per deciliter as well as millimoles per liter. So if you're in a country that uses millimoles per liter, you'll see it here in parentheses. There it is. That's the translation of this value into the other unit, which is also used and also validated. But what then would be the value for prediabetes? Between 100 and 125. And the value for diabetes is 126 or higher. That's right, a lot of people think that. To be diagnosed with diabetes, you need a much higher value. But actually, no, that's not true. A value of 126 is already enough for a diabetes diagnosis. It's important to remember that these tests, like the fasting blood glucose test I'm mentioning here, should be repeated 2 or more times, never just once, because this test can also have errors. For example, if at the time of the test you had a cold, the flu, or were really stressed out, that can cause a slight change. You saw earlier that it could already be considered diabetes even if the person doesn't actually have it. So you have to be careful about that. You should repeat the test or combine it with another method, but preferably repeat it twice. If you have a cold or the flu, like influenza, what can happen? You might increase your adrenaline and cortisol levels to fight off that infection. That can definitely cause your blood sugar levels to get out of control. And there could also be a lab error. It's rare, but since this is such an important diagnosis in a person's life, it's worth repeating the test to confirm it. Well, this is a very commonly used test, which is fasting blood glucose. The second test, which is also very important, not just for diagnosis, but also for monitoring diabetes, is the glycated hemoglobin test. What is that? This test reflects the average blood sugar levels over the past 90 days. It's an excellent and very useful test. However, there are some shortcomings. These can lead to a false interpretation, a false diagnosis, or incorrect monitoring or treatment. For example, people who have anemia or very thick blood, this can affect the results. People with kidney failure, especially when their kidneys are functioning at less than 30%, need to be very careful with this test. Certain stages of malnutrition and some hemoglobin disorders, like sickle cell anemia, can also affect this test. There's a very, very common catch with the A1C test, which is that it measures the average blood sugar levels. A lot of times, you might have many spikes in glucose, But at other times, you have hypoglucose, which is when your blood sugar is very low, levels below 70 milligrams per deciliter. And if you've been following the video, you saw that this test is an average. So for people who have a lot of variability, sometimes very high levels and sometimes very low, this test can give a false result because you end up just averaging it out. It's that old story. If you take your body temperature and your head is in the freezer and your feet are in the oven, the average temperature might look just fine. But in reality, you're in a very, very dangerous situation. So you have to be careful with this issue of averaging and also consider your own factors. But what are the values? This value here for glycated hemoglobin, up to 5.6 is considered normal. 5.7 to 6.4 is prediabetes, and 6.5 or higher, I make the diagnosis of diabetes. Also, ideally, you should repeat this test twice and be careful with all the possible mistakes and misinterpretations that this test can have. And the third test, which is also widely used, is the glucose tolerance test or oral glucose tolerance test. What is that? It's that test that the lab does. You go in for a blood test and then you drink a solution with 75 grams of glucose, a sweet liquid they'll give you at the lab. After 2 hours, you'll take the blood glucose test again with a new blood draw to see what happened. This is done to check your body's insulin sensitivity, to see how your body handled the glucose and how it reacted to it. And after 2 hours, if it's less than or equal to 140 milligrams per deciliter, if your results are in millimoles per liter, you can check that as well, okay? I made sure to include all these values. Prediabetes is from 140 to 199, and diabetes is when 2 hours after drinking the glucose, your level is 200 milligrams per deciliter or higher. This alone is enough for a diabetes diagnosis as well. I mentioned 4 tests. Usually everyone talks about 3, right? But there's an exception, which is what's called random glucose. What does that mean? It's a random glucose test, not necessarily done while fasting, okay? For example, you go to a hospital, you get a blood test, and the doctor gives you a diabetes diagnosis. How's that possible if you weren't fasting? There's a diagnostic criterion, which is when the person has classic diabetes symptoms. In this case, just one test at any time of day can confirm the diagnosis. Like, for example, being really thirsty, losing a lot of weight, peeing a lot, that sweet smelling urine that attracts ants to the bathroom, or feeling extremely tired. In this case, here, just one test can give the diagnosis at any time of day. All the other tests have criteria you need to follow. Why is it this test that gives the diagnosis? Why is that the case? It's exactly because you have the classic symptoms, and this test, the random one, should show a result higher than 200. All right, so that part is clear. Let's move on to the follow-up tests for diabetes, as well as the test using a glucometer. We use a test that is one of the standards for monitoring diabetes, which is the glycated hemoglobin test itself. Do you remember the values for diagnosis? So here, as a rule, we want a value around 7%. It can range from about 6.5% to 7%. In some cases, like people who are at risk for hypoglycemia, when blood sugar drops too low, such as the elderly, for example, we want to avoid that as much as possible, so the doctor might tolerate a slightly higher test result. For example, a glycated hemoglobin of 7.5%, or in some extreme cases, even higher. 8% glycated hemoglobin. So it's not a one-size-fits-all formula, something that's set in stone. There's this guideline, which is around 7%. In some cases, for diabetes, the treatment goal can even be 6.5%. However, we have to individualize. The patient is at a very high risk of their blood sugar dropping too low. The doctor may tolerate it, already being aware of this, and knowing the possible effects of a slightly higher glycated hemoglobin. However, there's also the risk of it dropping too much, so you have to be very careful. With this issue of treatment, okay? But in general, it's around 7%. If your doctor said something, that's why I mentioned it, right? These nuances and interpreting test results can vary. Sometimes a test result might be good for one person and really bad for someone else. And another test that's also used for monitoring and keeping track of blood sugar levels is the test with the little device. This is actually the main topic of questions in just a few videos. Most of the time, people will focus only on the diagnosis, those classic ones. However, this follow-up test with a glucometer is extremely important, and we have to keep in mind that it can vary, okay? First group, people who have diabetes. And the second group, people who don't have diabetes. Because sometimes you do a test at home and you don't know what that result means. If you don't have diabetes, this test, when fasting or before meals, should be equal to or less than 99. 2 hours after meals, for those who don't have diabetes, it should be less than 140 milligrams per deciliter, okay? Oh, but the test showed 135 2 hours after eating, 2 hours after lunch. Even so, is that normal? Isn't it too high? The answer is no, because you just ate. Your body needs to process that. It's not a problem if it's 135. The problem is when your body always has high blood sugar like that. All right? For example, when you're fasting, then yes, a high value is a concern. Now, after eating, there's a margin of tolerance that your body can handle, and it won't cause any problems for you. And now, if you already have diabetes, this is an excellent test for monitoring. And when fasting or before meals, we want a value for diabetics around 80 to 130 milligrams per deciliter. If you are diabetic and you check your blood sugar 2 hours after eating, when I say after eating, I mean 2 hours after you start your meal, okay? It's not 2 hours after you finish eating, it's 2 hours after your first bite. Did you know that? If you didn't know, then you absolutely have to subscribe to this channel and turn on the notification bell so you'll always be notified whenever I post, because this information is really valuable and can completely change your treatment. A lot of people do this test the wrong way because they start counting 2 hours after they finish eating. That's a really common mistake, and a lot of people make it here. So 2 hours after you start, are you going to do this test? And the capillary blood glucose test, the one you do with a glucometer, it should be below 180. Oh, but again, 180. Less than 180. Isn't that still pretty high? And the answer is yes. Specifically after eating, that's an acceptable value. Your body has to deal with that food. It has to digest it, it has to metabolize that food. So yes, that's a value we can accept. Is there another test you want to know about? Genetic tests or autoimmune antibodies, which we use in some cases. You want to know more? Then go ahead and ask your question here, specifically. What can I do? Part 2 of the video if you want. So yes, only with more detailed, more refined tests, which aren't routine diagnostic tests, can we explain it that way. What do you think? So right here, part 2 and the test you want me to include. Did you notice I didn't talk about insulin? You want to know more about insulin too? So, right here in the comments if you have diabetes or not, and which part of the world you're from. I'm speaking from Porto Alegre. Now I'm going to leave a recommendation. It's a video where I talked about the signs and symptoms of diabetes. Did you know that diabetes can cause a lot of symptoms? Many times, the diagnosis is made based on the signs and symptoms even before the person gets tested. We've already put together this diagnostic hypothesis. So if you click here, you'll learn more about the signs and symptoms of diabetes. Take care. See you next time.